Gut and liver article. Title is Impact of Visceral Fat on Survival and Metastasis of Stage 3 Colorectal Cancer. Previous studies have investigated the relationship between visceral obesity and the risk of colorectal tumors. Visceral obesity may affect the outcome of colorectal cancer, including survival and metastasis. We investigated the associations between visceral adipose tissue and oncologic outcomes in Stage 3 CRC. 472 patients with Stage 3 CRC were identified. Subcutaneous and visceral adipose tissue areas were measured volumetrically via computed tomography for each patient at different levels of the lumbar spine. After adjusting for age, sex, and other clinical factors, the effects of visceral adipose tissue area on mortality and recurrence were assessed using Cox proportional hazard regression. In univariate and multivariate analyses, a higher visceral adipose tissue to total adipose tissue ratio and higher visceral adipose tissue to subcutaneous adipose tissue ratio were both associated with poor CRC-specific survival. Interestingly, in the evaluation of each site of recurrence, a higher VT ratio and higher VS ratio were both related to a higher risk of peritoneal seeding and tumor recurrence. The VT ratio at the L3-L4 level was significantly associated with a higher risk of peritoneal seeding and tumor recurrence, while other levels showed no such relationship. Visceral obesity is closely related to increased risks of CRC-specific mortality and peritoneal seeding metastasis in Stage 3 CRC patients. Thank you for watching Gut and Liver article.